Good morning, everybody. It is a great pleasure being here this morning, try to convey some of our key learnings over the past few years. We've been studying innovation for a long time, and we actually have got to exactly the same conclusions that Dr. Nicholson actually presented to us this morning. Of course, he's a lot more eloquent than I can be, but I'll try to reinforce some of those messages within the healthcare sphere, which is what I do. There are two things that I would like to There are two key takeaway messages from my presentation. One is that in regards to innovation, there is a gap between intention and practice in Canada. And I'll try to explain a little bit why is that happening. The second is something reinforcing what Peter mentioned, which is in Canada, our innovation policies has traditionally focused on the push side. And I think it is about time that we pay attention to the pull side. They are very promising, and we don't have a lot of experience doing that, and it is about time that we change that. So, go quickly. What I will do, just quickly about who we are so you understand where my comments are coming from. A little bit about understanding innovation and innovation readiness in healthcare in Canada. Well, I'll present you some. I won't give you all the results of the surveys because that will take me a lot longer of the time that I have here this morning, but a few key results to give you a flavor of why the difference between the intention to innovate and really what is happening on the grounds. And then some challenges and opportunities. Very quickly, the Conference Board of Canada, as you don't know who we are, we're a not-for-profit applied research organization, independent from government, evidence-based. Everything that we do is based on our research. Everything we present, our recommendations and our offers are based on evidence. We do a lot of research and facilitating dialogue. We bring public and private sector together, so in that sense, the voices of public and private sectors are important to us. Okay, the first one, and this is very important, innovation is not invention. And this is very, very important because we need to understand what we are talking about. The difference between invention and innovation is execution, is implementation. You have a great idea, could be a brand new idea, generally driven by inventor or curiosity. It generally might come from a research lab, and you might be very familiar with that. It may or might not have real use today. That doesn't mean that in 20, 30 years, once other technologies are also advanced, it might have applications at that time, but it might not have real use today. Those are inventions. Innovation is not necessarily new. When we look at information and communication technologies, a lot of computing technologies, there was a study done in the United States looking at from the moment of those ideas were incubated, were created, to the point that they actually reach $1 billion market. In all of these technologies, in all of these sectors, the minimum time that had passed was 20 years. It takes really a lot of time because innovation is about the implementation of those ideas, and that requires a lot of business innovation, integration, modification of practices, and integration with other different technologies, and this is what really takes time. It's generally customer-driven, so it's not curiosity or inventor-driven. There is a need for that innovation to happen. And as I said, generally it results from a business process. So it is very important to understand because I find often that we don't necessarily know what innovation means, particularly in healthcare. When I go to hospitals, they also confuse improvement and innovation. Improvement and innovation are not the same thing, and I won't go into those details, but it is very important to keep that in mind. So according to our definition, innovation is a process that extracts economic or social values from knowledge using the generation, development, and implementation of ideas to produce new or improved products, services, or processes. This definition is aligned with the OECD definition and many others. So the key thing here to keep in mind is that if there is no extracted value, it could be social or economic value, we don't call it innovation. So not all ideas, you can extract values out of those. If you can't, then we don't call it innovation until we're getting to that point. In health, innovation is not going to come from one particular part of the system. We need to look at innovation within a system perspective. This is what I call the health enterprise, and this is what we use to understand how innovation happens within healthcare. We have healthcare organizations, it's all the range of organizations that provide healthcare services, from long-term care to home care to acute care. That includes all hospitals, all providers. We have academia, you have to do a lot of research and training in those institutions, and then you have industry. And they actually work in tandem, and innovation works extremely well when you have all those three pieces working in tandem, very in sync. So around that, there is many other things, which is what Peter said. Those are part of the policies that can speed up those transformations and collaborations. And they are important because they can actually enable that or could be an obstacle for those transformations. So a little bit about some of the survey results. So very quickly, before this kind of represents the summary of 81 responses that we got across Canada, all different provinces were represented. The majority of responses came from Ontario, Alberta, and British Columbia. These were provided by all the executive seniors from hospitals. We were targeting hospitals and long-term care organizations and the large home care agencies. 20% of these respondents had actually budgets over $50 million, so they were not small. And when you look at this, it actually starts putting very clear that there is very good intention to innovate, but there is very little efforts to implement innovation in those places. There is an almost unanimous agreement that innovation is essential for the sustainability of Canada's healthcare system, and also that innovation is essential for improving their organizational performance. That's a given. Everybody can relate to those concepts. But when we started asking them whether innovation is a recognized priority in their organization and whether innovation has designed, the organization had designed and implemented plans to achieve certain innovation targets, the level of agreements went down significantly from the other two. This again, commitment to innovation. So it was almost unanimous agreement that they make an effort to develop the teams and the organizations committed to continuous improvement. But when you start asking what are the aspects of operationalizing innovation, how you implement innovation, the level of agreement went down. We embraced creativity and experimentation, started declining. Less agreement in terms of continually search for clinical medical fields in which our organization could be global best. Formally review new ideas before accepting or rejecting them, even less, and actively eliminate all the processes or services for new or improved ones. And that actually relates to the example for the cataracts surgery that Bill mentioned. What is the role of the boards? And I find that this is one of the key challenges. I'm not convinced that our boards are actually trained and educated in what innovation is within healthcare and how they can guide it. This is only, we asked several questions about boards, but it's actually just a little under 1/3 of the respondents thought that the board was setting clear and measurable innovation goals for their organization. The majority weren't sure about that. And that is troublesome because if they don't have an objective that is set up for them to do this, then where is the motivation to do something about innovation? That's a real challenge. This is another interesting one because we all often hear that the number of patents that we have in our universities don't compare well with the number of patents that you might see in the States, for example. So we asked them, and this was only responded by the organizations that do engage actively in research and development. So do you engage in research and development, yes or no? And if it's yes, then answer the following questions. So only 30% of those respondents always and frequently have efforts to protect research and development. The large majority are not. And that, from an innovation point of view, it was extremely concerning for me. So what is happening here? Is it that we are not expecting to do anything with the research and development that we are doing, or we are not expecting that we can actually make some gains out of that, or that we don't really understand how that connects with the rest of the healthcare system and what are the potential applications that can have. And I don't know the answer of that. The other thing in healthcare, and this is really interesting, is that the introduction of new products and processes into health system has been always perceived as a cost driver. And that is something that is critical in the culture of the healthcare system, because that has prevented the adoption of innovations that can actually enhance healthcare system performance and decrease some cost. I have seen a research in the UK where they have estimated the number of some specific drugs, cardiovascular drugs, cancer drugs, arthritis drugs. And those are the latest technologies, less than 12 months, and then they have one that ranges from 1 to 3 years old drugs, and then 3 to 5, and then over 5 years old. Canada is consistently one of the lowest adopter of earliest technologies. So we compare well with the other countries that they looked in that study. We compare well with France and the UK and Germany and other countries, the drugs that are been in the market 3, 5, 10 years. But the drugs that are really new, less than 48 months in the market, Canada is a very low uptake. In those. And we are actually replicating some of that work here in Canada, and our research we have some preliminary findings, is showing exactly the same. And this is a problem. So we just need to start shifting. I think the economic crisis that we had in the 90s, where we had a lot of budget cuts and amalgamations, had a significant effect in how we see the healthcare system. And we really need to shift our culture from the cost control mechanism to value generation, and start seeing how can we use the resources we have to get more, not less. And this is where procurement comes. So procurement is a very important policy tool. And we've been doing a lot of work on this over the past few years. And it's actually picking up internationally, and I'm glad to see that it's starting to get some traction in Canada as well. Basically, so we know what procurement is. Procurement is the processes that we use to acquire different products and services. That's what it is. In countries like Canada, where the healthcare system is public, we invest a lot of the public dollars in purchasing products and services. And that gives Canada a fantastic power to purchase these products. So if we are smart about how to use that power, we can actually incentivize innovation tremendously. How this works, it can work at 3 different levels. We call it the pre-commercial procurement, and that happens in cases where you have there is no product and there is a huge need. There is no products and services that are available, but there is a very large need. Then you use pre-commercial procurement as a research and development contract that allows the risk between public and private sector to be shared and speed up research and development. Has worked extremely well in development vaccines in the US and many other great products. And then you have innovation procurement policies that allows you to accelerate procurement within private providers to customize products and services that you need, or to uptake the innovative technologies that exist. We asked this question to the executives in Canada. So although 60% said that the innovative products were very important or important for their organizations, the majority also said that the procurement approaches in their organizations were not supporting the development and uptake of innovative products and services. That was really quite telling. So there is an issue here, and part is understanding how procurement works and how procurement can work differently for their places. So my last 2 slides, really quickly. Challenges. Innovation is not well understood within healthcare in Canada. I think we have very good intentions, but we don't really know how to implement it. So there is a lot of work in raising awareness and raising our capacity to do this better. There is a strong foundation in the culture, but there is room for improvement in the skills of the leaders and managers in healthcare, including board members. And also, traditional procurement approaches do not work well for the acquisition of innovative technologies. We know this, and but there are some options, and this is exactly what I have been working internationally, and there are fantastic opportunities for us. Opportunities. There is greater momentum for innovation right now. Although we have been talking about innovation for a long time, this is the point where we're starting to see innovation councils everywhere, at the provincial level, at the federal level. There is more emphasis on innovation across the entire healthcare system. And I think this is a tremendous opportunity for us. If we can present and articulate our ideas better, there are more probabilities to get support right now. When used correctly, procurement processes can be a very strong, powerful tool. We are starting to see procuring for solutions rather than products and services, what a solution means, what is value for money, how that translates into improvements. And that's a fantastic opportunity for Canada. Thank you.